Hi, I'm here with Dr. Ernie Feliciano, Medical Director of the Med Station on Forest Avenue in Glen Cove. Can you tell us briefly about the Med Station, Ernie?
The Med Station has been in our community for almost 30 years. Currently, we're in Glen Cove for 27 years until we moved to the boundary 2.5 years ago. So we're now on Locust Valley.
Great, okay. And I understand your wife is the doctor there, and she's going to come in and answer a few questions for us?
Oh, yeah, she is. She's going to come in.
Okay, great.
All right.
Yeah.
Hello.
Hi, Dr. Feliciano. How you doing?
Good, good.
So Ernie told us quickly a little bit about the Med Station. Basically, what is the Med Station able to do for those in medical need, both connected with the COVID-19 and other medical conditions?
Okay, so the Med Station, we are a walk-in family practice office, all right? Right now, we are still open, but we are maximizing the use of telehealth or telemedicine. So we are evaluating and treating patients through a HIPAA-compliant secured video conference or via the phone for people who have no internet. We are doing this to reduce everybody's exposure to COVID-19. And then if we deem that the patient really needs to come in for a face-to-face evaluation or if they need further testing, then we will determine that during the telehealth visit.
Okay, great. Do you perform the coronavirus testing there?
We do not perform the COVID testing here, but we do screen patients for that. In accordance to the CDC and Department of Health recommendations, there are certain criteria for people to be tested as outpatients. So we screen for that, and then if we deem that the patient needs that, then we will make arrangements for them to get tested.
Okay. What should we do while we're at home right now? Everybody's kind of being urged to stay at home.
Right. I mean, to reduce the exposure to COVID-19 and slow down the spread of the disease, it is very important for everybody to listen to Governor Cuomo to stay at home. While you're at home, remind everyone in your household the importance of practicing everyday preventative actions like washing your hands, covering your mouth when you cough or when you sneeze. Avoid close contact with people who are sick. Stay at home when you are sick, except to get medical care, and only after you have spoken to your medical provider. Clean frequently touched surfaces, objects daily, like tables, light switches, doorknobs, and wash hands often, especially after going to the restroom or blowing your nose. It's also important to stay connected. Call your family members on the phone, call elderly neighbors, and just keep up to date with the latest news.
Awesome. So we're coming into springtime. We've been treated with a very mild winter, and it's the weather's starting to warm up a little bit. Do you think as the weather warms up, we'll start to see a decrease in some of these cases?
We do not know. This is a novel virus. It's very new, so we do not know yet. Some people hope that it will be like influenza that abates during the warmer temperatures, but like I said, we do not know.
In other words, with the regular influenza, there's kind of a flu season, and we don't know whether this is really going to actually have a season yet then. Right,
we do not know.
Okay. I know there's some medication, azithromycin, and I can't remember the name of the other one. Do you think these are effective, or are some medications that you think might be effective?
Yeah, there are several ongoing trials out there. One is what you just mentioned, which is the Zithromax and the anti-malaria medication chloroquine or hydroxychloroquine.
That was the other one.
Yeah. Another one is injecting antibodies from people who have recovered from COVID. But then these are just trials. So we do not know yet. It is not recommended for treating patients with mild symptoms at home, nor is it recommended for prophylaxis. Like I said, it's an ongoing trial, so we don't know the side effects, if there's any adverse reactions. So, that's to wait and see.
Do you after somebody has the virus and they've recovered from it, if they've recovered for say weeks, can they still be tested to find out if they had it?
There's very limited testing kits out there, so we do not recommend getting retested. Yeah, we really right now we are reserving the testing for patients who really need it.
Okay. Well, that sounds great. I mean, Glen Cove, they're at about 26 cases from what I see right now.
Right.
Have you actually dealt with anybody yet in Glen Cove that has had it?
In our office, not yet. We've been lucky that we haven't seen anybody yet. We do get a lot of calls from people who are concerned, understandably.
Sure. Well, we won't bore everybody with going through all the symptoms. They've kind of been blasted on the media about all that, and the procedure is what to do.
Right.
At the med station, are they wearing and using the PPEs when seeing patients?
Yes, we are using PPEs, but like any other healthcare institution, our supplies are limited. We use masks, we use hair covers, we use goggles, but like I said, our supplies are limited. We have reached out to the state, but obviously their priority is the hospitals.
Now, I just happen to be in the supermarket. I see an awful lot of people walking around with the face masks.
Mm-hmm.
Do you think the face masks? I keep hearing conflicting things. Do you think they're effective in protecting yourself?
Well, right now, because of the limited amount of face masks, we are recommending only people who have symptoms to wear the mask.
Okay. Yeah, I see some people are actually making them online. There's some YouTube videos, and I know my wife made a couple there, or a few there, and they're looking to take them someplace. Do you think something like that would be effective at protecting yourself?
Well, if it's just clothes, like cotton, we really don't know if it's really filtering viruses. So it's still, I would not recommend it. I would rather people stay home, or if they need to go out into the open, 6 feet apart from other people.
Sure. So, like going to the supermarket, which is like the one place that we all kind of have to go.
Right.
You're saying don't wear the mask in the supermarket?
I mean, if you already have a mask, then that's fine. Wear the mask, but don't go out and buy the mask.
Right. Sure.
Supplies are already limited as it is.
Sure. Great. Well, thank you for being there for Glen Cove, and it's good to know exactly where you are, and hopefully I won't see you. So, did you have anything else you wanted to mention to everybody?
Just everybody stay home. If you do have any questions, you can feel free to contact us.
Sure. And for the record, we're obviously televideoing this. I'm alone in my studio. My studio is closed, so I'm just here alone in the camera room, and we're trying to produce a few of these videos where some of the local businesses and doctors such as you can kind of get the word out about what you're doing.
Okay.
So I hope if anybody would like, they can contact me. We have the information on this video. I'd be happy to set up a teleconference with anybody else that wants to come in. Well, not come in, but wants to do a teleconference from where they are to get this message out. So, Dr. Feliciano, thank you very much. I appreciate it, and we'll talk to you soon.
Thank you.